Great question came up in the Medicare billing group on Facebook. This was from a provider who is a licensed physical therapist and a licensed massage therapist. So this provider has been receiving more referrals from physicians for patients who are requiring treatment, but the provider is not contracted with Medicare. And so this provider was looking to get clarification on mandatory claim submission, what they're allowed to charge on a cash basis, what their options are for somebody who wants to come to this particular provider, but this provider is not a Medicare contracted provider, neither par or non-par. So my first go-to is there is an article, and what I'll do is I'll post it in the description below, an article discussing specifically the details around the mandatory claim submission law. I'll share the article specifically from CMS Chapter 15, Section 40, and CMS Chapter 15, Section 220 and 230 really, so that you can get an understanding of how Medicare works, what would be considered reasonable and necessary, what would be considered a covered service under the Medicare benefit. Remember, as a licensed therapist, a licensed PT, OT, or SLP, you're essentially required to submit a claim under the federal mandatory claim submission law, independent of whether you're contracted with Medicare or not. The challenge is if you're not contracted with Medicare, if you have no affiliation with Medicare, there's no way for you to submit that claim to Medicare because you're not going to show up in their system. So what are the options for you if you have a client that wants to work with you and you are going to provide what may or may not be a covered service? You don't know if it's a covered service until you complete an evaluation. An evaluation is always a covered service, especially when there's a physician referral involved. So one of my favorite ways to work through this dilemma until we figure things out is to find a therapist in your state who is contracted with Medicare, contracted as par or non-par, who right now during the public health emergency, we still have access to billable services through telehealth. So what I would do is I would connect the patient who wants to see you as a non-contracted provider with a therapist who is a contracted provider, allow that therapist to perform an in-person or a telehealth evaluation of the client to determine if services are medically necessary and covered under the Medicare benefit. In most cases, like for me, if I'm doing the initial evaluation on a patient who's independently living in the community, managing their finances, active in the community, feeding themselves, dressing themselves, bathing themselves, essentially doing all of their basic and other ADLs, they're probably not going to need the services of a physical therapist within the Medicare covered benefit beyond the initial evaluation, developing some goals, and creating some sort of plan of care. It could be a one-visit plan of care. It could be a plan of care that says, I want you to go see this individual physical therapist who is not contracted for non-covered services, and then check back in with me as a contracted provider on an occasional basis just to make sure that everything is progressing the way that it should. All of that is totally reasonable. It could be done on a telehealth basis. If you're a mobile non-contracted provider, the best case scenario is you could actually be in the client's home while the contracted therapist is doing the telehealth initial evaluation, and the three of you, the client, you, the clinician that's not contracted, and the contracted clinician, could all work together to create the best possible plan of care for this individual. I would not look at this as a barrier. I would look at this as an opportunity for you to bring in other clinicians and put your heads together. Preferably other clinicians that have a different perspective, that have maybe some specialized skill that they can bring to the table. I just think it's a great opportunity. I think right now with telehealth remaining a covered service until the end of the public health emergency, I would be taking advantage of this if I was a non-contracted physical therapist, occupational therapist, or speech language pathologist. So guys, let me know what you think of this idea. If you want to watch another video related to this kind of content, go ahead and click on this thumbnail right here. And if you have questions about anything else, please post them in the comments below. I'll catch you guys on the next video.